who's on the call and how you guys are kind of connected to the work that you do and the work that we're doing. So we'll start. My name's Amanda, and I work for the Coalition for Be Aware Blount on the Established Coalitions grant. And
I'm Carly Crawford, and I also am a Be Aware Blount staff member, and I work on the PFS grant.
So don't be shy, just hop on in and introduce yourself and tell us a little bit about what you do.
I guess I'll go next. I'm James McMillan. I'm one of the 4-H agents here in Blount County working with youth development.
Great, thank you.
I'm Jan McCoy, and I represent the parent sector.
Great, thanks.
I'm Amy Berger. I work with James, a Blount County 4-H agent.
Awesome.
I'm Eric Landry. I'm the new faith-based coordinator for East Tennessee's Grand Division. So previously you had Sarah Keel in this position. So whatever she was working with or whatever needs you may have as far as the state and faith-based coordinator, I will put my contact information in the chat box.
Perfect. Thank you. It's nice to meet you.
There we go. Couldn't get off mute there. My name is Aaron Owen. I was invited by Danielle, just kind of here listening and see what's going on here, and think this is a great organization and want to be involved any way I can. So
awesome. Thank you so much for being here.
I see we have Al North on here. Do you want to introduce yourself, Al?
Yes, Al North, and I am representing, as you can see on the screen, Celebrate Recovery Ministry.
Thank you. Okay. And is there anyone else that wants to introduce themselves?
Hey, I think I hopped in a little late. My apologies. My name is Stacy Hillenbrand, not Robertson. Shows up my maiden name for some reason. I work for Helen Ross McNabb Center in Blount County. I'm the services coordinator here.
Hi, Stacy.
Hi.
And I see Heather's on. Heather, do you want to introduce yourself? Maybe later. And we've got Jill connecting. We'll give everyone just a couple more seconds. All right, Emily, do you want to introduce yourself?
Oh, yeah. Sorry, I'm still trying to figure this out.
Okay.
I'm Shekels, and I'm an RN at Blount Memorial Hospital, and I'm the clinical educator for the for 5 South. It's the bariatric orthopedic floor and med surge.
Great, welcome.
Thank you.
All right, we have one more that's trying to connect right now.
I think it was saying that it wasn't going to connect.
Yeah, we'll go ahead and get started then. All right, well, welcome to our September meeting. We're, of course, virtual again. We're going to be looking at the possibility of holding maybe an indoor or an outdoor in-person meeting for October, just kind of depending on how things progress with our county and weather permitting and all of that too. But we want to thank you all for being here today. We know that it's takes a little bit of time to log in and to kind of be a part of this. So we appreciate you logging in today.
Yes.
We have some announcements. So we're going to start with one of our best announcements that we have. We've got some really great news. We wanted to let you all know that we are officially a 501c3 nonprofit. So that's really great news for us. If you've been kind of on this journey with us for a while, you know that this is something we've needed and wanted for ourselves for a few years now. But we actually were able to get our nonprofit status expedited through the IRS, which is kind of unheard of right now with everything going on. But we received our determination letter from the IRS last week. And I know if you're not in the nonprofit world, it may not seem like that big of a deal, or it may seem like just a formal thing. But it actually is great for us because it's going to allow us to receive funds for our coalition. We're going to be able to do fundraising, campaigning. We have a bank account now, so we can collect those unencumbered funds and private donations. And then big picture, the thing that we're working towards is being able to manage our own state and federal grant funds. And that's huge for us because that'll really boost our independence and allow us to do work even outside of the scope of what our current grants allow right now. So that's really great news for us. In the upcoming weeks and even this week, actually, we're going to be focusing really heavily on a fundraising campaign. So we're going to need your help on that. And I listed our P.O. box information at the bottom of the screen here. If you feel like you want to send in a donation to us, you can do it that way by check. We have actually this week already received some donations from private donors, which is awesome. And we are hoping by the end of this week to have a link up in our donor database system, which will allow individuals to donate electronically. So we'll be able to run a campaign on our social media platforms and then also through our possibly our newsletter as well. So that's just something to keep in mind there. Does anyone have any questions or comments about that? No? Okay.
All right, we can move on. All right, so last month we were able to hold a drive-through resource event on August 31st, which is International Overdose Awareness Day. And so this event was where anyone in the community could drive through and pick up a free prescription lockbox or Dispose RX, which is a safe way to dispose of prescription medications. We also had our regional overdose prevention specialist there, and she was able to do free Narcan trainings for anyone who might need that. So we had about 20 people come through, and we were able to give out about 30 units of Narcan. And so we weren't really sure what to expect this year because this was our second year doing a International Overdose Awareness Day event. And obviously with everything going on with COVID-19, we had to kind of switch gears a little bit, but we thought we had a great turnout, and we were really excited to be able to do something more tangible within the community. Is there anything that you want to add?
I think that covers that. Okay, so the fall is a really busy time for us ordinarily, and that's not different this year either. In October, we have our Red Ribbon Week campaign coming up, and we actually have a little short to show you that was released by the DEA, which spells out the Red Ribbon Week campaign and what it's about. We're not going to play the whole thing, but it's kind of helpful just to see what they put together.
So this is just a little clip on some of the things that we can offer to our schools.
I got something to say, come on, listen to me. We're living our lives drug free. Yeah. Drug free, you're drug free. Everybody celebrate with me.
It's Red Ribbon Week. We're the Red Ribbon Crew, and we're proud to be drug-free.
Does everyone here know what Red Ribbon Week is?
Red Ribbon Week is a celebration that happens every year during the last week in October. Millions of kids, teenagers, and adults in the United States and around the world wear red ribbons to display to their friends and family to show them all that they are committed to living a life that is free of drugs. You should have been given a red ribbon.
All right.
So that's just a little snippet of what Red Ribbon Week's about. It's a campaign that we've been doing for the past couple of years now, and it's predominantly with our school systems, but we're also looking at some of our like Boys and Girls Clubs and other youth-oriented agencies as well to work with. So this year, the plan is to do a lot more virtually, some virtual education training, some printed materials. Obviously, there are limitations around in-person trainings and things like that right now in the school systems, which I completely understand. But we're still wanting to really kick it off this year. This year's theme is Be Happy, Be Brave, Be Drug-Free. And so Red Ribbon Week actually runs October 23rd to October 31st. And one of the things that we're wanting to do, since we're going to have a stronger virtual component this year to this, is have individuals that are members of different sectors that want to give a little media kickoff to each of our Red Ribbon Week days. So we have a couple of people lined up to basically just give a small pre-recorded snippet or comment on the importance of being drug-free for youth and for our community members as well, so that our community members can see just kind of a variety of individuals that are talking about this, because that is important. And we also know, of course, Red Ribbon Week is important, and this education is important to youth, because the younger that a person is at their first age of use of a substance, the more likely they are to have an addiction problem later in life. So this is something that is very important to the work that we do into our campaigning. So if you're interested in that, we promise it will be quick and painless, and we can do most of it remotely at this point. But it would really just, and we could even help anyone come up with, if you're looking for words or if you're wanting something scripted, we can help that too. We're just looking for individuals to help us push that message out each day of Red Ribbon Week, so that it's not just coming from us or from some of our more familiar faces necessarily. So is anyone else working on anything that they want to share with us as far as Red Ribbon Week goes, or ways that we can collaborate with your groups?
Yes, I have something.
Oh,
can you hear me?
Yes.
Okay. I am working with the mayor's office and the Justice Center about lighting up the clock tower and the Justice Center Red for that week. And also somebody suggested to me about coming up with a virtual background for the teachers that have to do the Zoom classes or the virtual classes.
Yeah.
Maybe come up with some kind of a background for them with our logo on it. I think that would be a great idea. And also for the businesses that have Zoom meetings and things like that.
That is a great idea. And that I hadn't even thought of that, but that's a really, really easy way to do some awareness and promotion. We can come up with that too. If you have the connections and you want us to help with the visual part of it, we can definitely do that. That's a great idea. And maybe just having some businesses commit for that week to use that background. Another thing that we can do are Snapchat filters. And that's pretty easy to do too, so that when youth in a certain area, we can use some geofencing, are able to use the filters in a way that we can track that has to do with Red Ribbon Week and the themes with Red Ribbon Week. So I think that's great. And let us know kind of what you need with that. And then is anybody else doing anything, or is anyone immediately thinking I would be interested in kind of being a spokesperson, is kind of how we're framing that.
Hey, Amanda, I'm sorry. I had a distraction and I may have missed it. But when you come up with that virtual background, and would you be able to send it out to like all of the coalition members so that we can have it on when we are in a Zoom meeting?
Yeah, Jan, I think that was your thought, right, with that, as far as that would be something accessible to anybody?
Yeah, I think it'd be great.
Mm-hmm. Yeah, so we can have that. And the idea too with Red Ribbon Week, what we've done in years past is every day we kind of take a different topic or substance. So alcohol, tobacco, prescription drugs, marijuana. There's usually a day where we focus on parents, because of course we know that frequent and casual conversations, which is what we talk about it so much, but that really does make the difference for kids at home with whoever they're living with, their caregiver. Those frequent casual conversations about substance abuse and letting kids know how you feel about it, what your position is on it, and that you want them to say no to drugs specifically. So that message, we usually try to pick at least one day to push that out to parents as well. So yeah, we can find a way to do that and do the back. Have you done the backgrounds before, the virtual backgrounds?
No, but I can figure that out.
Okay, so we can get the media and we can send that out to you, Jan, and then that's something we could send out to anyone to use, and that in itself could just be part of a kickoff to the week as well. I think that would be great. Any other questions or thoughts on that?
Two things.
Okay.
Can you hear me?
Yes.
Sorry. Carly, I think that Canva has Zoom backgrounds. I don't know how well they work. I haven't seemed to be able to make any of them work, but you're younger and probably more tech savvy than I am, so that might work better. But I know that they do have that now, where you can do those Zoom backgrounds, and I would be happy to do like some kind of a message for that week as a spokesperson.
Yeah,
So,
that would be great.
yeah, and the other thing, and you probably know this, Amanda, but with your 501c3, obviously now you are eligible to for discretionary grants, and also we are opening up the COVID-19 fund back up. And so if there's anything that y'all are doing that's related to the increase in substance abuse due to COVID-19, you could submit a grant even as a non-partner. Well, and you know that, Amanda, through CIC, but they're opening that back up. So that would be another option now that you have that 501c3.
No, that's an excellent point, Lisa. Thanks for bringing that up, because I actually didn't realize the non-partner piece of it. So, so that's great.
Yeah, there's a little bit more that you have to do as far as the application itself, but I mean, it's not extensive. It's just basically like the information that we wouldn't necessarily have if you weren't a partner. Probably like the financial piece, which should be relatively easy because you just started. But I think that's it. And then I think the actual grant portion of it is the same.
Great.
Yep.
Okay. Maybe if you have time this week, maybe if we can talk a little bit more about that, and just get some information from you and figure out what we need to do for that.
Yeah, just let me know.
Okay, awesome. Thank you.
Thank you.
Anybody else with Red Ribbon Week? Like we've said, this is one of our bigger pushes in the fall. And in the past, we have had pep rallies. We've had in-person training events in schools. We've had parades for kids. And so it is a bummer that we're not really able to do the majority of those things, but we are kind of trying to keep the impact as high as we can. So if you have ideas, we are actually looking through some things from the DEA, because the DEA has shifted their focus a little bit this year too to accommodate virtual learners. So we're still thinking about that, thinking about them too, because so many of our students haven't come back to school yet. They are still learning virtually. So we're thinking about that, and we're open to suggestions. But if you're willing to do any kind of a spokesperson, if you want to take a day of the week, like what Lisa just said, we would really appreciate that. And that would be a very tangible way for you to be a voice for us.
I have a quick question about Red Ribbon Week. So I do the Health Rocks program in the middle schools, which is focused on drug, alcohol, and tobacco prevention, and it's a great program. I love it. We're doing it virtual this year, which is challenging. But my question, I was thinking maybe you all could come into the classrooms, but you would have to be there for all day 3 weeks, and that's not going to happen. So I didn't know if you all or if several of us could make just a short little, maybe 5-minute video that I could share with them, just to talk about Red Ribbon Week and talk about your theme.
Absolutely. And that's exactly what we're looking for. You know, a lot of classroom education time is pretty accounted for. So if we can partner with some programs that are already in classrooms and are already doing work, that's great. And that's definitely something we want to do, Amy. So do you have my contact information?
Go ahead and give it to me just in case I don't.
It's Amanda at beawareblunt.org.
Okay, perfect. I'll send you a quick email. Thank you so much.
Sure, no, thank you. That's perfect. So we've already had some great suggestions. Does anyone else have any suggestions or thoughts on Red Ribbon Week? Are you already doing some work that you'd like to partner on? Anybody else? All right. Well, we look forward to reporting back to you because in October, we will actually have a meeting right before Red Ribbon Week kicks off. So we can revisit this again. But of course, we're trying to sort of get everything planned out now so that we have an idea of what things will look like for us. So thank you.
There we go. All right, so switching gears a little bit, September is National Recovery Month, and it's also National Suicide Prevention Month. And so I just kind of wanted to touch on what both of these mean and just remind anyone who might not know. So the goal of National Recovery Month is to increase the awareness and understanding of mental health and substance use disorders and celebrate those people that are in recovery. We know this is no easy task, and we know that you can't do it alone. And so we just kind of are always interested in reducing the stigma around substance use disorders and recovery in general. And we also know that substance use is pretty heavily tied to suicide. And so just a quick reminder about suicide. So suicidal thoughts, like other mental health conditions, can affect anyone. No one is safe from it, you could say. And so these thoughts can be common, but they shouldn't be considered normal, is our message here. And oftentimes there's something more serious going on if someone is having those suicidal thoughts. And so I just wanted to share a couple of quick statistics about suicide and how it relates to substance use disorders. And so a stat from the CDC was that those with opioid use disorder involving prescription opioids was associated with an increase of 40 to 60% in the risk of suicidal ideation. And we know that suicide rates are not going down, and that in 2017, 10.6 million people thought about suicide, 3.2 million people planned for suicide, and 1.4 million people attempted suicide. And so on the screen, I've also included the suicide prevention lifeline. And so it's that 1-800 number. And recently, it was approved to have a 3-digit number for suicide prevention. And so that hasn't been officially launched yet, but that will be coming really soon. And that's pretty great because it'll be just like dialing 911. So that's a little bit easier to remember, and hopefully a lot of people can use that.
And those digits will be 988 on the screen.
Yes.
Right there. So we will keep you posted. One of the reasons we talk about suicide, just to kind of go off of what Carly said, is that this past year, the Tennessee Department of Mental Health and Substance Abuse Services added in suicide prevention work as part of a component to implementation planning. And that was because of the significant correlations and linkages between substance abuse and suicides. So that is something that we take seriously, and it is something that we kind of want to be thinking about, especially right now, because so many people are still isolating, or a lot of people are either still doing some kind of virtual recovery group, or maybe they've fallen out of the habit of being in recovery groups. I'd really love to talk to some of our local recovery groups that have started hosting in-person meetings and see what that attendance is like, because I know, kind of like anything, when you get out of the habit of it, it gets harder to sort of continue with that. So we want to be thinking about those things this month, but always. And if you know someone that needs help, please give them the information they need, ask questions. And if you want more information about QPR, which is a program on suicide prevention, we can definitely link you to that as well.
Yes, and the Tennessee Suicide Prevention Network, TSPN, they have a ton of great resources, and I think they actually just relaunched their new website with all of that on it. So definitely check that out if you or someone you know might need that. And then we can also send that information out in our follow-up email.
Yep. Any other thoughts or comments, something that we've missed on this?
May I make a comment?
Yeah.
Obviously, I mentioned, I'm associated with Celebrate Recovery, and I wanted to share that I would second what you've been saying about the relationship between addiction and suicide, mental health struggles. I know that's what we've experienced dramatically with our open share groups in Celebrate Recovery. I was fortunate to be able to continue Zoom with, I facilitated for military veterans, and I can't tell you the challenges we faced during the pandemic. Fortunately, we had a group of men in this particular case that are supporting each other through some very difficult times. And so I want to be encouraging everyone that, if somebody is struggling, to have them consider attending a Celebrate Recovery event. And we have Monday night, Tuesday night, Wednesday night, and Thursday night Celebrate Recovery Ministry in the community. So if you have any questions or thoughts about that, you can go on our website and get additional information about Celebrate Recovery and the location of the sites themselves. But it is a great way to come together and support each other in an atmosphere that's not judging anyone. So I just wanted to share that with you. Thank you for allowing me to.
Yeah, thanks, Al. Another thing too that we'll be doing is we shared a list of virtual resources back in the summer for virtual resources for any kind of recovery programming that you might need for different services and different kinds of addictions. So we'll be sharing that again today on our social media platforms as part of just a way to continue to have resources available to folks. So thank you for that. If there's anything, if you're with a part of a recovery group or you're a part of any kind of association with recovery groups and you want us to share information on your group, please just send us an email and we will push that information out on our social media platforms. All right. Okay, so we are doing in October a little networking group. The name might need some work, but the thing that we came up with was Prevention Pals, which is basically just an opportunity. We have so many of these meetings where we come in and we follow an agenda and we get out and that's kind of it. And we talk a little bit, but what we really want to do is we want to have a networking event in October. We're looking at October 15th. We want to do this in person, possibly outdoors at one of the pavilions, but we'll keep you posted on that. But it's basically for anyone that is working in any sector that's connected to prevention work. What we really want to do, and the point of that is to talk with our existing partners and anyone that might be new to the field or maybe their agency or companies moving in that direction of wanting to work in substance misuse. And we want to talk about ways that we can collaborate and really discuss what our common goals are and see what we can do together. So that's kind of the whole point in that. So that's going to be October 15th at noon. We will send out another reminder through our newsletter and our social medias as well, just to kind of remind everyone with an RSVP option. But yeah, that's something that we haven't really done, but we want to be able to have kind of an informal meeting to just talk a little bit about and give you guys the opportunity to tell us everything that you're doing in the community and ways that we could collaborate. Does anyone have anything to add on that or any questions? All right. Oh, we forgot our drug take back announcement.
Oh, we have an announcement.
We lost a slide. So this is important. We have drug take back that is occurring on Saturday, October 24th. Mm-hmm. Okay. So mark your calendars for that. We haven't had a drug take back event in a year. And that's due to COVID and the fact that it is, we are asking a lot of our officers when they're working directly with the community like that. But it's going to be the same setup as it's been in years past. It's October 24th. It starts from, it goes from 8 to 12, 10 to 2. Yeah. We'll have this sent out in something that you can see in a flyer. But it's going to be at the Justice Center. If you're familiar with the Blount County Justice Center, we have kind of a roundabout drive up. You do not have to get out of your cars. And in fact, this year, we're probably encouraging you not to get out of your cars if you can help it. But an officer will walk out to you, will take all of your prescription drugs that you have. You don't have to worry about packaging. You don't have to worry about your information. I know a lot of people are concerned about that because all of that gets incinerated. And so we are hoping to have a big day on the 24th. We want to show that in those numbers that we can still get those medications collected and out of our community. That's been a concern for us, obviously, for a while now, but that is a component of our prescription drug prevention. And so if the best thing that you can do is just show up for us if you have any prescription drugs that you've been holding on to, but it's any unwanted, unused, or expired meds. They'll take any of them. And the point, I guess, is that it's super convenient and not at all intimidating. Our officers are very nice, and they'll meet you at your car. They'll take your whatever items you have, and then that's all you have to do. You can keep driving straight on through. So any questions on that before we roll into agency announcements?
I have a question on the drug take back. Are y'all going to take sharps and inhalants during that time? Because I know DEA has stopped some of the other counties from taking sharps because of COVID and because we're doing drive-through events. So if you're going to do that, you might want to clarify that on the flyer, because I know people from other counties may come in if they have sharps disposal if you're actually taking them. So
we haven't heard differently. So I will definitely confirm with our drug task force just to see kind of what they're planning. Of course, historically, we have taken both sharps and inhalants, but I'll make sure that we know, because I hadn't heard any differently. Thanks for pointing that out. But as far as I'm concerned, we're still planning on doing that. But we'll clarify and we'll make an announcement if we hear differently. And we will have another coalition meeting before drug take back, obviously. But the biggest thing outside of bringing your meds that you can do for us is to spread the word, because there are so many people in our community that have no idea that this is a day that we do and a service that we provide to our community.
And for reference, we typically collect anywhere between 500 and 700 pounds of prescription medications. And so,
and that's in 4 hours.
Right. And since we weren't able to have our spring event, we're anticipating that there's going to be a lot of prescription meds just kind of like floating around out in the community. Yeah. So we're hoping to kind of collect a lot of those.
Mm-hmm. Any other thoughts or questions on Drug Take Back Day? Okay, so let's roll into agency announcements then. What do you guys have going on that we need to know about or that you'd like to announce? All quiet. Well, I know that fall is usually a busy time for a lot of people, but we also understand, of course, too, that situations are different and that plans are changing. So if there's ever something, if you're doing an event that you want us to announce, again, on any of our newsletters or social media platforms, let us know and we'll do that for you. Does anyone have any kind of last comments or thoughts? You can even type them in our discussion box if you don't want to say it out loud.
I'll go ahead and make an announcement.
Okay.
So I just wanted to remind everybody really about the crisis counseling helpline that Helen Ross has here that services Blount County. We received funding from FEMA, and I just want to let everybody know that this is it's a free service, and basically it's for people that are needing resources related to COVID-19 or just resources in general. Doesn't have to be that you're in a complete crisis. It could just be for some resource linkage. But obviously, if someone is experiencing some difficulties due to the pandemic, they can call the number as well, and we'll be happy to assist them. So if you want more information about that, you can reach out to me. I'll go ahead and just throw my email in the box down there and be happy to help you. And it's for anybody. Doesn't matter who you are. Be for people like us, teachers, people that work in the medical field, anybody. Thanks.
Thank you, Stacy. Yes, so that's a great resource for Blount County, and we will be sure to push that information out to you. If you want to send it our way, we'll push that out. Anyone else? Okay, one last thing to kind of jog for you guys to just jog your memory to be thinking about. We are still looking to fill one more board member seat right now. I know we've talked with several of you guys and we've had some interest, which is great. If you or anyone that you know that you think would be a great fit is interested in joining our board, please just reach out to us and we would love to connect you with some of our existing board members and talk a little bit more about that process, especially now that we're continuing to develop as a 501c3 and really get the ball rolling on all of those things. So I guess on that note, if there aren't any announcements from anyone else, we are going to hop off here, and we hope everyone has a great week. And we hope to be hearing from you soon and just hearing about what you're doing in our community. Bye.
Bye. Thank you, everyone.
Thank you.